Well, welcome everybody. Looks like we're ready to start. Good morning, everyone. I am Daria Curtis, Healthcare Industry Consortium Strategist, and I'd like to welcome you to the Healthcare Industry Consortium Q1 meeting. Thank you for taking the time to join us today. We truly value the time and expertise that each of you brings from across healthcare, education, workforce, and state agencies. Before we begin with the opening remarks and welcome from our executive leadership team, Ronan, would you please remind us where to find the materials and any Zoom instructions that we might need to know before we begin?
Sure. So meeting materials have been sent out to members in advance. They're also located on the HECS Industry Consortium webpage under the Healthcare Meetings tab. All consortium members attending should have access to their cameras, microphones, and the chat. If you are a member and you don't have access to any of those things, please let me know. And we ask that for action items, consortium members use the chat to indicate their vote. And as this is an especially packed agenda, we'd also ask that you use the chat for any comments or questions on presentations so that if we're unable to answer you live, we can follow up with you after the meeting. All right, back to you, Daria.
Thank you, Ronan. And now, executive leadership team, you're welcome. The floor is yours.
Hi, Daria. This is Miranda, co-chair of the consortium and also member of the Governor's Racial Justice Council. Again, I just want to welcome everyone, especially during these challenging times with their economy and also with federal changes and mandates. I think your time is really important. And I think your expertise, experience, your knowledge is really much needed. So I just want to say thank you for taking the time to be part of this consortium. The work now is so important right now that I feel like your leadership and your time is so important that we definitely want to value that. And thank you again for being part of the consortium. Thank you, Daria.
Thank you, Maria.
Good morning, this is Janet, and welcome everyone as well. I couldn't agree more with what Marin just said. It's really tough in the healthcare market. There's a lot of big things to solve, but there's also progress, and I think this is an opportunity to celebrate wins, even if they're small wins, and to encourage each other to keep plowing through the current environment and get us to a point where we can all benefit from the changes that we're trying to effectuate. So thanks again for being here.
Good morning, everyone. I am Dr. Bennings, the president of Portland Community College, and just so honored to be here and see how we continue to show up for this important work, and especially in the days and times and the future ahead. It's increasingly important that we gather together to set the path forward for our communities, for our workforce, and just for the overall betterment of our state. So I'm so appreciative and grateful to be here with you all and continue this work.
Hi, everyone. I'm Melissa Unger. I'm the Executive Director of SEIU Local 503. I don't think I have much to add the rest of the team said, but looking forward to 2026 and the leadership coming out of HEC to continue this important work to think about healthcare workforce.
Thank you, executive leadership team. And I think, Dr. Bennings, we're ready to jump into the presentation. Thank you.
Thank you. So I just want to take a moment to share, a look back in terms of our shared commitment, our work, and the impact that we've made as a group since convening as the Healthcare Industry Consortium. Next slide, please. So just a little bit about our background. Our industry consortium was established by Section 10 of Senate Bill 1545, which, just as a quick reminder, was a 2022 package of investments that really were set to work together to advance equitable workforce in terms of system and structure, supporting people with education, training, and resources that they need to get into good paying jobs. And so that background is very critical because you look at the power of the legislative, the regulatory environment that has set us up to be impactful in this work. And so that's just a reminder for many of us too, and those of you who are curious about how we came to be where we are today. Next slide. So if you look at our charter, I've taken some components of our charter and just really summarized them in terms of the work that we have been delegated and authorized to do. And these 5 areas of terms come to mind when you review our charter and when you think about the times that we have come together to do this important work, which I'll highlight some of the progress here in the next slide. But I just want to read through these because they're very powerful and they speak to the what and the why of the Healthcare Industry Consortium, but also highlight the importance of this work that we're doing together. So in purpose at the highest levels, we're here to catalyze innovation and co-investment. We're also here to coordinate cross-sector action. So when you think about the membership, we have a very diverse membership from backgrounds and experiences and industries and organizations. That is very critical to this work because this work cannot be done in a silo. We're also here to advance equity and talent development. We all know that in specific industries, as we're talking Healthcare Industry Consortium, there are gaps in equity. And so our work is really intended to mitigate any gaps, but also set up a future where this is not a looming concern to the extent that it is today and has been in the past. We're also here to inform policy and funding decisions, which we'll get to see one of the progress indicators on the next slide. And then just leverage sector expertise. You know, there's this saying that comes to mind that, well, now I lost my train of thought, but when we come together and get to group think and brainstorm, it's the power of information and knowledge sharing that really gets us to moving towards areas of innovation and areas of impact and transformation, especially in this day and age. And so that at the highest level is just a glimpse of the detailed purpose in our charter, but just wanted to share the 5 tenets of where we convene as a healthcare industry consortium around this purpose. Next slide, please. So progress and impact. Now, this is just a glimpse and a snapshot of our progress and impact since starting. And so starting with 1, the foundational work. If you recall, when we got together, we were trying to figure out what are we doing, how do we do it, and how do we work together in this space? And it took several discussions and levels of discourse to really get some footing around our foundation, because we couldn't move forward unless we knew, 1, how we were going to do the work, how we were going to do it together, and what that meant for us as a consortium. So the foundational work led to, really establishing a leadership team, the charter, and ultimately setting the tone for this collective body of work. When you talk about policy investments, one of our greatest, all of these are great impacts and progress, but one that resonates through our work over the last year has been the Future Ready Oregon. We were able to, as a consortium, inform priorities for the 3rd round of funding for Future Ready Oregon workforce grants. And we know that is so vital to the talent pipeline in this state. And we had a role in that, especially when you think about the impacts and the awards that have gone out. We can say that we were part of that process, and we had some impact in terms of shaping the outcomes of the Future Ready Oregon grant investments. We also had a focus on the employer side of the house. If you recall, there was a series of employer focus groups. Of course, it's always important to engage the employers, especially as we're talking about talent, workforce, and education, because at the end of the day, it's how are we setting up the individuals, the workers, to be successful in the workforce, but also aligning with what does the workforce need. We also, in addition to the employer workforce, focus on there was some work group convenings. And so there was a funding work group and a behavioral health talent assessment steering committee. And those work groups also helped to shape the behavioral health, the creation of that behavioral talent assessment. If you recall, we spent some time in one of our meetings going over the outcomes and the report of that assessment in terms of specific roles, wages, and impacts specific to behavioral health. And that was something that came through our progress over the last year. We also had published occupation profiles for high demand, high skill, high wage careers in the healthcare sectors. Again, aligning with workforce and the occupational efforts, that was important to really set the stage for understanding the profiles aligned with the workforce and industry needs. And then, there was some work that was on the road. There were 2 on the road meetings that were conducted in Medford and Tillamook. And so our work doesn't just happen in these meetings, but our work does span the boundaries of the meeting space to across the region and across the state. And this is just a quick glimpse and snapshot, but sometimes we get so buried in the work. It's important to remind ourselves of what this work has led to and what we've impacted as members of this group. I don't know if there's a next slide, but let's see. Okay, so that is a look back. I know we're tight on time, but please reach out to Daria if there are any questions that we can share. But I don't know, Daria, if there's time for any immediate questions. We may have time for 1 or 2, but if you do have questions, I'll be happy to also address those and coordinate with Daria on this.
Thank you, Dr. Bennings. We are tight on time, but yes, please do send me your questions and I would be happy to share them out with the executive leadership team. Or you're welcome to add your questions to the chat right now. So let's see. Thank you, Dr. Bennings, for the presentation, and thank you, executive leadership team, for setting the ground for an interesting conversation to come in this meeting. Before I go over the agenda with everyone, let me jump into the public comment section of the agenda and see, do we have any public comment at the time?
We have no one signed up for public comment, although I would encourage consortium members to review a piece of written public testimony submitted for this meeting and follow up either with the HEC team here or with the submitter directly on their own time. Thank you.
Perfect, thank you. Now let's take a look at the agenda. Now I'll briefly go through the agenda for today. We will hear on the Behavioral Health Talent Council update from Julia Pantoni. Next, we will have Medical Oregon Board, who will present on Senate Bill 476, Internationally Trained Physicians. We will hear from our Executive Director, Ben Cannon, on HEC's strategic plan. And then with that, so we will move to the Workforce and Talent Development Board strategic plan presentation by Todd Neal. Then we will welcome Dr. Amy Cox, the Director of the Office of Research and Data, who will walk us through the key findings and implications for workforce development. And then we will have a break and come back to our 2026-28 strategic work plan discussion. We will break into some groups and then come back and share key themes, findings, and discuss the next steps. Next, I will move into the consent agenda. I'm not sure if everyone had a chance to review the meeting minutes from June 24, but I'd like to have a motion to approve the minutes. Is there a motion to accept?
I move to approve or accept.
No, second.
And a second. Looks like we have a second and a motion. Is there any discussion in regards to the meeting? Any objections? All right, hearing none, approved. Thank you very much. And now we will move into the next presentation, the very first one for today, from Julia Pantoni, Director of the Office of Workforce Investment. Julia, you're welcome.
Thank you, Daria. Good morning. As Daria just shared, my name is Julia Pantoni, and I am the Director of the Office of Workforce Investments at the Higher Education Coordinating Commission. Before I get to the Behavioral Health Talent Council, I just wanted to share, as you've seen via email, that with Jennifer Purcell's departure, Future Ready Oregon has moved into my office. My office leads the agency's work to align post-secondary education and training to labor market needs, in addition to managing a number of different state and federally funded grants around workforce development. We also support the State Workforce Board, the Workforce and Talent Development Board, that you're going to hear more from Todd Nell later about. And I'm really thrilled to bring the Future Ready Oregon team into my office. We've already been working really closely together, and this move will only increase our collaboration and alignment. And I'm particularly eager, and I know Daria and the other consortia strategists are as well, to strengthen and really clarify the relationship between the industry consortia and the Workforce and Talent Development Board, and how we can move together to move this work forward. Please feel free to reach out to me if you'd like to meet with me. If you have any questions, you wanted to raise any concerns, I'm always happy to meet with you all. So I'm also a member of the Governor's Behavioral Health Talent Council and wanted to provide a brief update on the council's work since Sarah Means is unable to be here today. The council's nearing its end. I believe our next meeting is next week. We also have one this afternoon. And this afternoon, a bulk of the meeting is going to be to discuss the draft of the council's final report. The meat of that report is a series of action plans to make progress in key areas that the council identified, like transparency about licensure requirements, reducing administrative burden on providers, et cetera. So these are just action plans assigning responsibility to specific agencies to really move these forward in a action-oriented way. I also wanted to flag that the governor has put forward a legislative concept based on the council's work. I'm not sure if you all have already heard an update on this from Sarah, but I'm sure a repeat would be welcome if you have. But the legislation does four main things. First, it requires the Oregon Health Authority to adopt a centralized credentialing process for behavioral health workers. It also directs OHA, Oregon Health Authority, to eliminate unnecessary administrative burden as part of their mission, and to report to the legislature and the governor every 2 years on steps that they have taken to reduce the administrative burden. It brings the Board of Licensed Social Workers under the Mental Health Regulatory Agency, so that it's, aligned with some other similar boards and to improve efficiency and customer service. And then finally, it directs the licensing boards to draft and implement rules allowing for any prospective master's level qualified mental health licensee to receive supervision from any qualified mental health licensed professional, regardless of whether they and their supervisor possess the same type of license. So I just wanted to share that. I'm sure you'll be seeing more information on that bill as the process moves forward. Happy to answer any questions about the Behavioral Health Talent Council. Probably can't answer many questions about the legislative concept, but I'm happy to also connect with Sarah Means and bring back any information from her to this group. Thank you.
Thank you, Julia. We have a few minutes left for questions, so if anybody had a question right now, or you're welcome to put it in the chat for later.
Looks like Duncan might have a question.
Yes, thank you,
Duncan.
Madam Chair. Julia, how important was our report to the work?
It was very important. It is front and center in the draft final report. It was frequently mentioned by the First Lady, who is the chair of the Behavioral Health Talent Council. It really was core to the report. In the one-pager, the draft one-pager on the bill, it references the report as well, I believe. Don't quote me on that, but it was certainly instrumental.
Thank you. I really did think that was a great report, and I'm very delighted that it's been put to great use. Thanks.
Great job, Julia. I just have a quick question. The points you mentioned, would it be available in terms of for us to look at, or is it part of the process during the session? What information can you share regarding that? I mean, there were excellent points, so love to.
Yeah, I actually was texting some folks before this meeting. I think I don't have the most up-to-date one-pager on the legislative concept, but when I get that, I'm happy to share it out. We should also have an actual bill pretty soon here. I know it's been assigned a bill number. I just don't know if it's actually public yet. So I'll share out when we do get that one pager and the actual bill.
Great, thank you. Good job. Thank you.
If we have no more questions, thank you, Julia. Thank you for the questions. Let's move to the next presentation then. Now we will hear from Nicole Krishnaswamy, who is the Executive Director of the Oregon Medical Board on Senate Bill 476, Internationally Trained Physicians. Nicole, you're welcome.
Good morning. Thank you so much for inviting me. This is my first experience with the Higher Education Coordinating Commission, so I'm really thrilled to get to know you all and to share a little bit about what we do. Daria, are you controlling the slides? Do you want me to share my screen? What's the best way?
We are controlling the slides. You are
Okay.
just welcome to say next slide and we will take care of it. Thank you.
Fantastic. Next slide then. Great. So this comes from Senate Bill 476, which passed in the 2025 session. So I'll be kind of talking a little bit about our agency, but then also focus in a lot on the bill itself and what program we're implementing and why we think it may interface a bit with your organization at HEC. So could you please advance? So the Oregon Medical Board is an independent agency. We don't report up to anyone. We report directly to Governor Kotek. Our mission is to protect the health, safety, and well-being of Oregon citizens by regulating the practice of medicine in a manner that promotes access to quality care. So we are the licensing board for physicians, PAs, and acupuncturists in the state of Oregon. I know there was a mention about other licensing boards, and so pleased to introduce you to ours. Could you advance to the next slide? So this is our licensee population. As of the end of 2025, we had just squeaked over 30,000 licensees. Of course, the vast majority are medical doctors, and in the state of Oregon, we treat MDs and DOs interchangeably, but they are a separate slice of the pie, if you will, on this slide. We have quite a few physician associates, and that number has been growing steadily over the last 20 years. Acupuncturists has remained at relatively the same number, and podiatrists, we only have just over 250 of them in the state of Oregon. But this kind of gives you an idea. Our agency is 42 people, 42 employees, and so we are licensing on a daily basis, regulating the practice of medicine generally, so things like telemedicine and prescribing, those are all policy issues and rulemaking that we do. And then in addition to completing investigations that there's been a violation of the Medical Practice Act and taking disciplinary action when necessary. Next slide, please. So currently, the US system for getting an international medical graduate and a license in the United States is that they have to go through residency training in the United States or Canada. And this means that for a physician who has done their education and training in another country and is perhaps mid-career and wants to come to the United States for their practice, to continue their practice, they really have to go back to residency and start kind of pretty much all over again. They don't have to repeat medical school, but they do have to start a US residency. And we know statistically that the longer a physician is out from their education program, the harder it is for them to match into a residency. And residency slots are already limited, as we know. And so it becomes very challenging, increasingly difficult to find a residency spot for internationally trained physicians. But this is the current process. This is the way that every state in the country has always managed licensure for international medical graduates. And what we've been challenging ourselves to do is to look at new pathways to get those physicians who are mid-career and internationally working into the US system without having to go back and repeat this entire process. Next slide, please. So from that incentive, and I should say that the Oregon Medical Board has been a leader in this. We actually introduced a resolution at the House of Delegates for all state medical boards where we come together every year. And we introduced a resolution that we would take this step to create pathways for licensure for internationally trained physicians. And part of that has been serving on this advisory commission for additional licensing models. We call it ACALM, ACAL short, just because advisory commission on additional licensing models is kind of a mouthful, similar to HEC. So if I slip and call it ACALM, you'll know what I'm talking about. The work has been published in the Annals of Internal Medicine. This group included the Federation of State Medical Boards, ACGME, ECFMG, which is the certifying body for international medical graduates, as well as the American Board of Medical Specialties, the American Medical Association. There are representatives from all of these bodies who are in this photo and have worked on this, this additional pathway. Next slide, please. So ACOM published guidance in February 2025. This was part one of the guidance that how could we come up with criteria to create a new pathway? And these are a very distilled version of the 9 initial recommendations. So they have to have graduated from medical school and they have to have completed postgraduate training. So something similar to a residency program. They have to be licensed and authorized to practice in another country. There is a recommendation that there was some limitation on the time out of practice. So if they've had a gap in their practice, that should be a factor. There was also a recommendation that they should be offered employment prior to being able to apply for this pathway, and that they have to have been eligible to apply for a full or unrestricted, the provisional license has to have a way for them to become eligible for a full or unrestricted license. And then state medical boards, of course, need to have rulemaking authority, and that we would report out on the data from who we're issuing these licenses to. Next slide, please. These QR codes do lead you to the full guidance document if you're interested in reading. There's some explanatory statements around each of those recommendations. The ACOM then reconvened to talk about part 2 recommendations. So once these physicians are here and they have a provisional license, how are we ensuring that they're successful? What we don't want to do is drop an internationally trained physician into a rural community where they're the only provider and they don't understand the US healthcare system and how to work with insurance companies and all of the nuances that are very unique to the US healthcare system. So the ACOM Part 2 guidance really focuses on how to build up their skill set and have them prepared to become eligible for a full unrestricted license. And I think this is the part that HEC can really be a good partner for us, because we're great at licensing and regulating, but we don't have an educational arm, and we don't have skills-based assessments. We don't have programs to help people become fully competent. And so this is where I'm hoping that maybe you all have the expertise to help guide some of our work here. So the Part 2 recommendations talk about internationally trained physicians should be competent in 6 general areas. These are the same 6 core competencies that residency programs are assessing. And so they're listed out here: medical knowledge, patient care, and procedural skills, interpersonal skills, professionalism, systems-based practice, practice-based learning. So those, we need their supervising or sponsoring physician to be assessing them to make sure that they are competent in these 6 areas before we sort of graduate them on to a full unrestricted license. And the physicians who are supervising this work need to have that skill set too, to understand how they are determining whether or not the international physician is competent in these 6 core areas. There's also a recommendation, number 2, that they go through a needs assessment at the beginning of the supervisory period so that the supervising physician or sponsor will know which areas they need to focus on. Where are they already competent versus where do we really need to focus? And then also a similar exam or assessment at the end of the supervising period so that we know that the person is competent to go for a full unrestricted license. And so there's also a little bit more detail about those assessments, that they should be longitudinal and periodic so that it's not a one-time snapshot of how the physician is doing, but really to make sure that they are growing and learning. Next slide, please. There's some more. This is still continuing on with Part 2 of the guidance that was released in August. So they should be able to demonstrate an ability to engage in independent and unsupervised practice. The level of supervision should be tailored so that we are really being supportive and and helping the physicians become fully independent, that the supervisor should be an MD or DO, that they aren't being supervised by a nurse practitioner or a PA, but really a fully licensed physician. And then that the rights of the internationally trained physicians are taken into consideration. The ACOM, the Advisory Commission, was very concerned that these physicians were not coming here and being misused and abused as workers, and that they were really treated fairly and given full consideration as physicians. Next slide, please. So the Advisory Commission guidelines then were used to inform Senate Bill 476. And 476 was brought by Senate Majority Leader Jama, and was it talks about a few different things in the bill, but I'm going to be focusing specifically on the parts that are directed to the Oregon Medical Board and set up a new provisional licensure pathway starting in 2027. So the effective date for this section of the bill is January 1st, 2027. So our work is really beginning now. The bill represents a critical effort to bring in qualified and fully trained physicians who have done their full training abroad, and they don't need to redo all of that. But at the same time, we make sure that there are some parameters and expectations around that so that there is not a compromise to patient safety. So the bill sets out the requirements for the license and what it means to practice under supervision, and that after 4 years under this provisional license, they would be able to apply for a full license. Next slide, please. Oregon is one of 18 states that have enacted legislation recently. So every state, their legislation is slightly different, as you would imagine. Every state approaches things a little bit differently. Oregon has really stayed true to the Advisory Commission recommendations. Some other states have requirements that make it very difficult to qualify for the pathway. So we've made sure to keep the barriers low. Another thing that other states have done is only recognize training from certain countries like England, Ireland, Australia, New Zealand, and of course, all of those countries are very common and heterogeneous. And what we have found is actually that 25% of internationally trained physicians are coming from India, Pakistan, the Philippines, Nigeria, and Mexico. So we want to make sure that we're inclusive of those countries and where the physicians are actually coming from. And then other states have made their provisional license not lead to an unrestricted license. So they could practice for just a short period of time under a provisional license, but it will never transition them to a full unrestricted license. So Oregon's approach has counted for those other variations and intentionally did not follow those same pathways. So if you see variations in state laws and have questions about any of it, I'd love to be able to talk with you about that and why we chose to follow the pathway that we have chosen. Next slide, please. So this is a breakdown of the entire bill, and sections 1 through 3 really talk about a different agency, and 4, 5, 6, 7, and 8 really talk about the Oregon Medical Board, but section 6 is the meat of the bill, and this is the part that creates the provisional license for internationally trained physicians. Next slide, please. So in section 6, provision 1 goes through the qualifications for the provisional license. So I sort of talked about these already: medical degree, training program, ECFMG certification, which this is a really important part because ECFMG is an independent body that verifies that they did complete medical school in good standing and that they've passed the first 2 steps of the U.S. medical licensing exam. And international physicians are well familiar with this licensing exam, but it does give us a baseline that they have general medical knowledge and some general competencies. So with that ECFMG certification, we already know that they are well on their pathway to being a safe medical provider. It also sets out that there must be at least 3 years that they have practiced full-time in another country or jurisdiction. So we really are aiming at those physicians who are mid-career and won't be able to get back into a residency program. And then, of course, we're going to want to make sure that they're in good standing so that we aren't having an issue where physicians are moving from one country to another to escape some sort of sanction on their license. We'll be doing a deep dive into that. I think this is a place where I should pause to also tell you that I wear another hat. I am the executive director for the Oregon Medical Board. I'm also the chair of the International Association for Medical Regulatory Authorities. So it's a association for medical boards around the world. And we've got representatives from all countries, not every country, but every region in the world. We just added Papua New Guinea and Singapore. And so there's lots of different medical regulators around the world. I'm very honored to be the first United States Medical Board as chair of the organization. And this organization is really dynamic. We learn a lot from each other. Low and middle income countries have so much to teach us. It's not all US driven and teaching others, but we're able to leverage those connections. And it's a really great opportunity for us to ensure that we are, if we're receiving physicians from another country, we have direct connections around the world to verify that they were in good standing. The International Association for Medical Regulatory Authorities, the acronym is IAMRA. We can't get away from acronyms. We also have a physician information exchange, which is a database similar to the National Practitioner Database, so that countries can enter in disciplinary information and we can check that database to verify that they are in good standing. So lots of good work happening there too. I think it's very relevant for our conversation. A little bit uncomfortable to talk about my own resume, but I think it's relevant for you all to know that we are partnering globally. Next slide, please. So section 2 of section 6 is that the provisional licensee has to, of course, submit an application and pay the fee that we establish by rule, which is yet to be determined, and then provide any other information that we need to assess their qualifications and background. Next slide, please. And then provision 3 in this section 6 talks about how the provisional licensee needs to practice. And again, I think this is where HEC can be a really great resource or a partner for us. So the Oregon, they have to be under supervision of a fully licensed Oregon physician. So we'll want to, of course, verify the credentials of the supervising physician. And then we need to set out some criteria for the physician who wants to supervise. So what do they need to have as part of their background? Do they need to have gone to a training that teaches them a bit about anything from cultural competency? How do you interact with someone who may be a limited English proficiency speaker? Or what do they need to know about their culture? Or what do they need to know in order to assess those 6 core competencies that we talked about earlier? So we've got to come up with some language to set out some criteria or requirements for who can be the supervisor. And then section 6, provision 3 also talks about what type of a facility they can work at. We currently do allow a similar pathway for internationally trained physicians to work at OHSU. It's a teaching institution. They have residencies. So that pathway has already existed for many years because the supervision is already well established as part of their structure. The bill language expands that so that they could work at an FQHC or other clinical locations. We need to define what those are. We really do hope that this helps rural communities, and we know that our rural communities are eager to have international physicians working for them. So but we need to make sure that we aren't throwing them into a place that they're not supported. So we need to determine what type of a facility can support an international physician in this way. So we need to come up with some parameters around that. And again, this could be an area that HEC can be helpful to us. You know, we aren't there yet, but we need to tackle that in the coming months. So we'll be looking forward to doing that. Next slide, please. So section 4 then goes on to talk about how we see these international physicians fitting into the existing structure. There are a lot of unknowns about this, as you can imagine. We don't know if insurance companies are going to add these physicians to their panels or not. We hope so, but that's outside of our jurisdiction. Similar for malpractice insurers, will they insure these physicians? That's going to be, again, outside of our control, but we're really hoping so. And some of the language in this section 4 is our attempt to encourage them to do that, because we're saying that even though it's a provisional license, they are fully licensed in the state for purposes of credentialing and billing, so they should be treated as fully licensed physicians. It also, of course, says that they're subject to all of the same statutes and rules that a fully practicing physician would be, so that we're holding them to the same standards of care. This is not intended to be a lesser physician in any way. We are expecting them to provide the same type of care that a patient could expect when they go to see any other physician. And just kind of wrapping that up, it has the same duties and responsibilities. Okay, next slide, please. So now our work is beginning. So the bill passed and was signed by the governor, and now we've started our work just in the month of January. We've been starting this. So the bill sets out the framework, and now we need to work on adopting rules for what the application looks like, what the license looks like, any renewal or registration requirements, and then what the supervision and assessment standards are, where they can practice clinically, and what their clinical assessment is, and then any other things that come up along the way as we're trying to sort this out. Next slide, please. So we convened an ITP work group. I should have said this earlier, along the lines of acronyms. International medical graduates, we currently have every day practicing. IMGs is their acronym. And we intentionally are using ITP for the purposes of this bill and this work, because these are internationally trained physicians. They're not just medical graduates. These are fully trained and fully practicing physicians. So we're using ITP as our acronym for this particular pathway and this work. So we've convened an ITP work group, and the link there will take you directly to the work that we're doing on this. These are the members of the work group. I'm really, really proud of the widespread of folks that we had who, as you can imagine, there's a lot of interest in this work, but we've been able to pull some really dynamic people together, both representing associations who are interested in this work, and then facilities like an FQHC down in Klamath, as well as OHSU, who's got interest and experience in this area. And then physicians who actually are participating in this work from Uganda, and where else do we have? I'm forgetting now off the top of my head. Egypt. There's such a variety of folks who are coming together and participating in this work that it's going to be a really well-rounded group. Next slide, please. This is a timeline. So on July 31st, the bill was actually signed by the governor so we could start our work. Our first meeting was just last week, and we're very happy to have Daria there presenting on HEC and the work that you all do so that we can get the ITP work group sort of thinking about who our partners can be. As we start crossing some of these bridges, we'll really need to know where we have resources that we can maybe call up and say, hey, we need some help with this part, we're stuck. Our next meeting will be next week, and we'll be talking mostly about the qualifications for licensure. How are we verifying that a residency program has been completed in another country and that they've been employed in another country. That's something we've never had to do before. So we need to figure out a way for to verify. Denise asked a really pertinent question at this moment. So is this for all specialties? Is this everything from family practice to cardiology to neurosurgery? Yes, it is. We are going to open this up for any specialty who wants to apply. There was a discussion, and I think 1 or 2 states may have decided that it would only be for primary care, and that is not the option that Oregon took. We are going to say that we will evaluate credentials and see if there's a way that we can get them here practicing successfully. We don't know what that will look like. I keep using the "if you build it, will they come" analogy, if you remember that old movie. We don't know, but we're going to make it wide open and see who can apply, and we'll do our best to verify their residency. So, and that's, as I was saying, we've never had to verify residency training abroad before, but it's going to be critical that we do so. And if we just, I referenced OHSU last week. If you just look at OHSU, that's one institution in one state, in one country, and there are so many residency programs just in that one institution. We're looking at, of course, at an infinite number of residency programs around the globe in different specialties and different institutions in different countries. We're really going to have to be granular and looking at what was included in their curriculum. If it's a surgical specialty, we need to look at how many cases they were required to do before they finished that residency training. It's really going to challenge our staff to find new ways to look into the quality of the residency program to make sure that it's substantially similar to what we would expect them to have gotten in the United States. So we're going to do our best, but it's going to be a big challenge for us. And so we're going to be tackling part of that, having an introductory conversation about what that might look like at next week's meeting. Recruiting specialties. We are not recruiters. There has been some conversation about whether medical boards could be sort of like a matchmaker, and we would find an internationally trained physician and find a facility and try to hook those two together. And that's really outside of our scope of authority. We aren't able to do that, but there are partners who can help with this. The Office of Rural Health is a great partner and can help with recruiting certain specialties for certain areas. So we do work with them commonly. They may send us an applicant and say, hey, this person really wants to come and work. So can we get them licensed? And we'll work with them to find out exactly what we need. The Primary Care Association also does a lot of this work. They have international physicians who want to come and provide care. And so they will match facilities with physicians as well and help them with the visa process. Our partners at OHA do have help for visas. And so we've been learning from them. They also came and presented to us. Thank you, Neelam, for doing that last week. So there's a lot of details to work out. We're going to leverage all of these partnerships and see if we can get folks to the right place. I'm happy to take a question if you want to go.
Yeah. Hi, Nicole. This is Moran. Quick question. Do you have certain goals that you want to meet in terms of how many internationally trained physicians you want to have processed annually? And what is the current people that are processed annually right now? And how will this improve that process to increase the number?
So I wish I had a firm answer to that. And I will say that of the 18 states that have passed legislation, my understanding is that there have been 3 licenses issued. So we are not certain that this will be a workforce solution. And it's certainly not a short-term workforce solution. But we will work our way through as many as will come. I do think there are a few things that Oregon has going for it. maybe we'll be more successful than the other 17 states who have started this work, which it's not very mature work because these recommendations just came out. I'm hopeful because our legislation is open to everyone. We've kept the barriers low. We make sure that we are approaching it in a way that's culturally competent. And then also because we are a sanctuary state, I think our policies are really supportive for our international folks. So I'm very hopeful that we'll be more successful, but we just don't know. I also want to go back to a previous comment in the chat about behavioral health. I recently spoke in Bangkok. Actually, it was an amazing opportunity to the World Federation for Medical Education. They have an annual conference, and I got to meet so many young physicians who are very interested in this kind of work, very interested in working in the United States. And I would ask them, "Oh, what's your specialty?" And they would say, "Oh, I'm family medicine." But they said, "But most of my practice is actually doing psychiatry." And I said, "Oh, well, that's interesting. You're a psychiatrist." In most of these other countries, primary care includes a heavy dose of psychiatry. So I think that if we're able to get some of these physicians who say that they're a generalist, who say that they do family practice, they're actually going to be behavioral health providers. So I think that we're going to see a lot of that naturally, that talent coming our way, because they don't differentiate psychiatry from family practice in the same way that we do in the US. Neelam.
Yeah, no, thank you, Nicole. This is so exciting. I just want to thank you so much for your work for creating these alternative licensure pathways, and just wanted to share, OHA has the physician visa waiver program. And thank you also for the opportunity to come and share about that program. That is one pathway for international medical graduates to practice here in the US. We get 30 slots for placing international medical graduates. And we find that, there's quite a bit of demand for those slots. And I also wanted to share that right after the bill was passed, we heard from a physician about their excitement about applying for this provisional medical license. So I also share your hope that, this will be a exciting pathway here in Oregon. I know with our physician visa waiver program, I mentioned we, don't have problems filling our slots. We know some other states do. So I think, to your point, this is, a place that people want to come, and it is a attractive place, from many perspectives. And I will drop a link in the chat for everyone. There's a recent summary from our program if you'd like to learn more about it.
Looks like we have 2 minutes left for any questions or any last comments or feedback. If none, I think, thank you, Nicole.
Thank you so much for the invitation. It was really lovely to be here, and I'm at your service if I can ever provide any follow-up information for you.
Yes, thank you for joining us today. Thank you so much. And again, if anybody has any other questions, you're welcome to put them in the chat, and then we will get them answered. Thank you. Now I'd like to welcome our Executive Director, Ben Cannon, who will share with us updates on the HACS 2024-29 strategic plan. And over to you, Director Cannon.
Yeah, thanks, Daria. Hello, everybody. I'm happy to be joining you this morning. Really appreciate your service on and participation in the Healthcare Industry Consortium. These employer, educator, community partnerships that you represent, along with our other industry consortia, are a really important part of the way that we're trying to inform and shape the HEC's work in workforce development. And really excited about the progress that you've made and the support that you've made for us in that and the work that you have ahead. Recognize that many of you are giving up valuable time and considerable time for this effort, and really just want to begin and probably end with that note of appreciation. I'll spend a few minutes with this update. This is a really big picture look at the Higher Education Coordinating Commission's strategic plan. We adopted this plan. The commission adopted this plan a little bit over a year ago, and we've been working on implementing it bit by bit and developing plans for implementation. So I'll focus on the plan itself, again, at very high level, and happy to answer questions or talk to some extent about implementation efforts if there is interest. Next slide, please. I think somebody's got control of these. Great. Okay, so the Higher Education Coordinating Commission, I assume most, if not all of you, have at least some familiarity with the commission and the agency. It's a 15-member volunteer commission. This document that I'm presenting today, the strategic plan, really does represent the work of the commission, our volunteer governor-appointed Senate-confirmed commission that oversees the agency that I lead as its executive director. I report to the commission, work closely with the commission on this plan, and did so in partnership with a lot of community members, education leaders, other state agencies, our staff, various folks who helped to inform this over the year and a half that it was under development. And among the things the strategic plan does, not surprisingly, is update and refine our mission for Oregon, and that's reflected on this page. This attempts to sort of talk about how we do our work. What are the categories of activities? Because, as I like to, remind folks, the HEC doesn't really do education or training. We work through and with others who provide that kind of support to Oregonians. So our functions as a coordinating agency and board are represented in the mission statement, and on the left-hand side of this slide, strategic coordination, funding, outreach, services, reporting, and leadership for systems change. So again, a sort of coordinating role, a leadership role, a funding and administrative role, even as we're not actually doing the work for the most part, of directly with Oregonians seeking support in career and et cetera. And then on the right-hand side, you see the purpose of it all. These activities are driving towards equitable post-secondary access and success, anticipating and meeting workforce and economic needs, and strengthening Oregon's collective future. Next slide. All right, so turning to the sort of strategies themselves, we organized these around 5 goals that the commission set, and each goal has strategies linked to those. So I'll start with the goals themselves. I won't read through every piece of this slide, but sort of the highlights. The commission put a new focus on this strategic plan, and I think it's the 4th in the commission's 12-year history that it's developed and released. But in this strategic plan, the commission put a particular focus on relevance and responsiveness. You see that in goal 1. So really trying to focus our education and training systems on meeting the goals and needs of learners, employers, and communities through a kind of more responsive set of programs, skill building, et cetera. Goal 2 is probably a longer standing commitment on the part of the commission to better align our post-secondary education and training system to create straightforward pathways for learners. Goal number 3, again, another longstanding goal of the commission's to promote affordability and access. Number 4 sort of elevates, I would say, principles and values that the commission has operated with for over a decade, but it's expressed here in terms of belonging and ensuring that we have a set of post-secondary experiences in which learners feel like they belong. And goal number 5 is, again, a newer, and in some ways out of this plan, kind of the newest area of work, I think, for the commission, or newest sort of spirit of the work for the commission, which is its sense of increasing responsibility for trying to infuse post-secondary education and workforce development into Oregon's economic development strategies. So I think better building a tie between workforce development, higher education, and economic development. I can say a little bit more about that when we look at the strategies themselves. Next slide. Oh, that's it. Okay, so there, what I want to do at this point then, since the slides here don't actually refer to the strategies, I want to point out the link that's at the bottom of this slide, which is where you can go and see the sort of back side of this plan, where these 5 goals are expressed, and then for each of them, there are between 3 and 5 related strategies. Totals 19. And those are the more kind of specific types of activity that we're engaged in, or the commission expects us to be engaged in order to achieve these goals. So in the interest of time and potentially to promote, give us some opportunity for conversation, I'll stop here, but of course I'm happy to talk about the kinds of activity that we're undertaking, or that the commission envisions us undertaking, related to any of these goals. So yeah, happy to say more if there are questions or comments. And with that, I think I will stop. Maybe somebody can also put the link in the chat. I would do so, but I'm not very handy that way on the fly. Marin.
Hi, Ben. How you doing?
Good.
Quick question. Can you expand more on the last one in terms of
Yeah.
the link into economic development? 'Cause that's so important that we have
Yeah.
that link or the connection.
Yeah, really appreciate it. Yes, I'm happy to. Yeah, so I think certainly I've operated with a longstanding view that higher education and workforce development are critical for the state's economic future. What we haven't done very well as a commission, agency, and state, I think, is ensure that post-secondary education and training is at the table and part of the conversation when statewide, as well as regional and local economic development strategies and activities are being planned or undertaken. This can means some very granular things. For example, if the state of Oregon, probably through Business Oregon, that state economic development agency, is attempting to recruit or retain a company, and that company expresses a need for a particular kind of talent, we want to ensure through this strategy, or through this goal and strategies linked to this goal, that state economic development officials, it could be regional and local ones as well, know who to call, namely potentially us, to work with them and work with post-secondary education and training institutions to develop responsive programs, training, education to help meet those needs of the business. So that's sort of a granular way in which, a very tangible way in which we hope our activity, our attention to this goal will, and our increased relationships with local, regional, and state economic development officials will build, will foster that kind of activity. Could mean, for example, that we're working with the legislature to try to secure funding to meet certain education or training needs that particular employers express. This could also mean at a much more sort of strategic or policy level, how learning from, again, economic development leaders, business leaders, industry consortia, learning more than we have known in the past about the future of our industry and the economy and its relationship to education and training, and using that to deploy investments, not necessarily in the service of a particular company or a particular occupation, but of a industry sector more generally, or the state's, a regional economy. So that's sort of one set of strategy, and it has our initial work in this vein is really about building relationship, trying to help ensure that we are known as a resource for could be employers, but more likely, what the regional economic development officials, state economic development officials know that we have staff who they can call to respond to those needs or to be at the table when those strategies are crafted. So that gives you, sort of a sense of the type of activity that we're trying to amplify through this goal and its related strategies.
Well, thank you for sharing that. As a business Oregon commissioner, I want to see more of that alignment. Business Oregon and HEC, everything you mentioned sounds great. So I'll look forward to learning more about that and hearing more about that. Thank you.
Yeah, thanks, Maureen.
Yeah, hi, my name is Chris DeMars. I'm with the Oregon Health Authority and Director of the Delivery System Innovation Office there. And I appreciate the affordable access goal. And given the economic situation our state is in right now, and it will be over the next couple of years, I just love to hear what your vision is for how to achieve that, given our financial constraints in Oregon right now.
Yeah, I think it's a great question. And historically, I think when we've thought about affordability of post-secondary education and training and sort of what we can do about it, we've focused primarily on state investment because of the very clear relationship between state investment and tuition costs at our public institutions, scholarship and grant funding that the state provides, right? These are all just basic state investment, public investment kinds of questions. And yet, here we are in a moment where resources are really tight, right? We are not particularly optimistic about the likelihood of securing large new state investments, public investments in higher education and training that would directly impact affordability the way that they have actually over the past decade. There's a kind of a good news story here about the past decade of increased legislative investments in higher education and training that actually has brought down net price for most students at our public colleges and universities. So, but that's kind of in the rear view mirror. Now we're facing this real challenge. So we will continue, of course, to advocate for and make the case for help lawmakers understand the relationship between public investment and affordability. But we're also looking, to other things we can do. And so, for example, one of the three strategies associated that I haven't shown you that's spelled out by the commission associated with this particular goal is to support institutional efficiency. And by institutional, we really mean primarily public colleges and universities, and supporting their efficiency through incentives and in some cases one-time investments that in systems that can over time help to decrease costs and improve access and affordability for students. A lot of the recent focus of the commission has been on helping institutions, again, primarily public colleges and universities, work build scale. We're in a pretty stable or flat enrollment environment, rising costs, dim prospect of new investment, limited new investment. And so part of what we're attempting to do through policy leadership, through coordination, and through convening is support efforts at the institutional level to build scale, interinstitutional partnerships, whether for shared administrative services, for example, whether that's IT or payroll, HR, cybersecurity, et cetera, or in program delivery itself that can, again, it's certainly not a kind of silver bullet on affordability, but it can help to mitigate some of those cost increases over time.
Thank you.
Heather, I think we have another question for Director Cannon.
Thank you, Director Cannon. And just to follow up on Chris's question there, I appreciate, I'm glad to hear the efficiency component. Native Oregonian, went to state school, kids in state school, also kids in private school. And I really appreciate the efficiency part. Is part of the strategic plan also looking at, one of the things I find intriguing is supporting students in timely graduation as an efficiency is something that I think there's a lot of room for improvement, and also would increase affordability and attractiveness of universities to the students. Yeah, it's having it's a thing. I see you nodding. Is that addressed at all?
It's huge. We don't I don't think that timely graduation is those words are called out specifically in this kind of 2-page plan currently, but that has been a continuing theme and priority for the commission. I think we get at it most obviously in the plan through our work on alignment, where part of the reason why some students end up taking considerably longer than the expected, 4 years for a bachelor's degree or 2 years for an associate's degree is because transitions, and you think of transfer students, community college to university, are not are clunky, right? And they're sort of lost credits or credits that don't get applied to the degree in that. There are also, even for non-transfer students, there are issues of course access, of increasing requirements for certain majors, inefficient or ineffective or insufficient advising for students that also contribute to the fact that our graduates spend longer than advertised on their degrees. We've seen a little bit of progress. This was a big priority, for example, for the University of Oregon for about 6 to 8 years, and they brought down that time to degree by a bit. And I don't have the other data on the top of my mind, but there's certainly a lot of attention to this issue, and the commission tries through the limited sort of powers and authorities and influence that we have to be a check on what within higher education can feel like this sort of a inexorable kind of creep towards longer and longer more and more program requirements and longer duration to degree. So completely recognize the phenomenon and share concern.
I appreciate it, and I'm glad that it's in there in some component. And I think it really ties hand in hand. I'm a behavioral health professional and made my way through the gauntlet of being a licensed clinician. And I think, blending that with the industry connection, because that is one thing that we find in our industry in behavioral health is the journey is long, the need is great, and the students come out with excessive debt to wage ratio. So, which of course the schools have no control over that component, but a long duration or a complex journey just layers on top of that.
I will say one thing that I think is relevant to some of you, at least in kind of healthcare, which is that one portion of this, or one contributor to this phenomenon that is outside of our control, and outside of the universities and colleges' control, is the role that licensure plays and increasing licensing requirements. So I just want to, we're working with colleges and universities on, standing up doctorate of physical therapy programs. I mean, that's an example of a profession that has concluded that, raising the number of years of training in order to be a physical therapist is appropriate. We don't play a part in that decision. It does contribute to the cost associated with becoming a physical therapist, and there are versions of that in other healthcare fields that you all probably know more than we do about. But that is that is certainly a contributor to what you're describing.
I think we have a question from Neelam.
Yeah, I just wanted to thank you for that great presentation and the wonderful discussion we're having. I just wanted to mention, to the point that Heather just made about the high cost of education, OHA does offer loan repayment incentives for professionals who provide direct patient care in primary care, oral health, and behavioral health professions. And we've found just incredibly high demand for those incentives due to the high cost of education. It helps to relieve some of their student debt. You know, those incentives are provided in exchange for a service commitment in a federally designated or other shortage area to meet patient need.
Thanks. We're super grateful for OHA's work in helping defray costs for folks training for healthcare professions.
With that, with no further questions, thank you, Director
I
Cannon.
see Duncan has his hand up. You better give.
Quick one. Thanks, Ben. Thanks for this presentation. I'd just love to get your perspective on these consortia. And one of the things you were just talking about was the licensure, which I would say today's meeting suggests we've made huge progress on addressing that through this consortia in terms of the behavioral health recommendations the governor is presenting. I'm just wondering, as you think about economic development, what is our role here? I mean, it seems like we could play a significant role in mapping out pathways to quality jobs for industry and help address some of these policy issues.
Yeah, I think one of the challenges, you and I have talked about this, Duncan. I mean, one of the challenges in my role, probably any higher education leader's role in Oregon, is a kind of lack of clarity about the future of work, jobs, occupations, needs for skills by industry, potentially by occupation. And in the absence of that, without more clarity, higher education and the HAC is sort of doing the best we can to try to prepare Oregonians for jobs, for careers. More clarity particularly from employers, consortia of employers, will be really helpful in shaping how we invest in, set policy for, convene and support colleges, universities, and other training providers. We can't make it up. We can't sort of on our own know what the sort of healthcare needs or the skill needs associated with healthcare will be in 2 years, 5 years, and 10 years. We really do depend on industry leaders in particular for that kind of information. And so to my mind, one of the most important functions of these consortia is to help higher education, understand how we can be responsive, right? We're here to serve the needs of the state, and in large part that's employers, because we know students come to our schools wanting a career, right? And so I guess just among the many things that I think these consortia can do is better articulate for higher education the workforce needs of your industry. And I know, I mean, healthcare is so challenging and changing. But to the extent that it's possible for industry to be organized through these and related mechanisms and then provide clarity for higher education, we can take that information and put it to good use. There are states where my counterpart is able to go to the legislature, go to the governor with a very clear sort of proposal for investment in specific types of training and education in order to meet specific industry needs, right? But we need to learn what those are, right? And we need to learn those from employers in particular. Healthcare, again, I think healthcare is complicated because that's such a strong public sector overlay, right? It's not a free market sort of activity. It's very much policy driven, but and publicly financed to such an extent. But that's what I'm hopeful for in these consortia.
I suspect that we have more questions probably left for Dr. Cannon, so I encourage everybody to use the chat and I will share them accordingly. Thank you, Director Cannon, so much.
Yeah, thanks. And I'll respond to what I can if there's anything that comes in on the chat. Thanks, Daria. Appreciate it, everybody.
Thank you. Thank you, everyone, again for the questions, and I encourage you to take a look at the chat. We do have some links there that were just recently shared with everyone. Now we will hear from Todd Neal, a director of the Workforce and Talent Development Board, Office of Workforce Investments. Todd, I'm turning it over to you.
Thanks so much, Daria. Can you hear me okay?
Yes.
Oh, great. Well, good morning, everyone. My name is Todd Nell, and I'm the director of the Workforce and Talent Development Board. The WTDB staff, as we're affectionately known, is located at the HEC in the Office of Workforce Investments. And I just wanted to thank you all for the opportunity to be here this morning and share a bit about the Workforce and Talent Development Board. Next slide. The WTDB has many roles and responsibilities. A few of the buckets, well, most of those responsibilities are shown here in these 4 buckets. These are mandated by federal and state law and are, as you can see, around planning, policy, strategy, systems alignment, which Ben touched on and applies at the HEC, innovation, accountability, and continuous improvement. We've approximately 30 members and are required to have over 50% of those members come from business. The notion there is to help capture talent and workforce needs of employers. Like the HEC, the WTDB, as Ben mentioned, similarly is about leadership for systems change. Now, Ben, as many of you know, is a member of the WTDB, and that board, our board, plays a consultancy and advisory role to the HEC. So leadership from the WTDB, you might find this interesting, was directly involved for, in the spirit of that systems alignment in the development of the HEC strategic plan that Ben just shared. Oh, and I was thinking, it was good to see your face, Marin, on your question around economic development. I'm just going to pop this in here so I don't forget. I wanted to share that the WTDB partners with Business Oregon. Melissa Drugi is a member of the WTDB. A couple other recent developments that maybe you're aware of, maybe you're not. Skip Newberry with Technologies Association of Oregon, and his economic development mindset is our new vice chair. So we work closely and are really leaning into that closely with Business Oregon and regional and local economic development folks, and are really trying intentionally with the 3 consortia staff here at the HEC to lean in and really leverage that work and relationships. And it's good to see Duncan here as another, I would say, quasi, if not economic development entity. We work closely with Duncan and Kyle at OBC on many levels. As many of you know, the Healthcare Consortium is advisory to the WTDB on specific sort of sector input around identifying skills gaps, training needs, and industry priorities to inform workforce and talent development policy, investment, and strategy across the broader workforce system, education and training, which would include K-12 and the public workforce system, or as many of you affectionately know it as WorkSource Oregon. Next slide. So the WTDB also has a strategic plan, which is aligned with the HEC strategic plan and really pushes to reach our strategic sort of vision of equitable prosperity for all Oregonians via a mission of empowering Oregon's workforce and employers, and also by informing and shaping an inclusive, coordinated training and education system that's responsive to their needs. The board also has, as you can see here, articulated on the first page of our plan, a position and reputation to uphold its work together. As you can see, over the last year or so, by the way, we've added this bottom section to really help better move the board's sort of interaction and results forward with values and agreements as far as how we conduct our business. So these marching orders go a little bit deeper on page 2 of the plan, and it contains 4 imperatives, which you'll see on the next slide. So here you can see that our imperatives are around inclusivity in the workforce system, and not surprisingly, that advances equitable prosperity given our vision. Also, strategic alignment, clear understanding of and improved use and impact in the workforce system, and last, accountable workforce system leadership. So we also have, as you can see, corresponding objectives for each of those imperatives that are outlined to the right of this slide. And they're really around increasing understanding and awareness on barriers, access, innovation, alignment, importantly through data gathering and analysis, and really striving to utilize that to reach goals, better results, and really sort of, as the governor has as a priority, lean into customer service and being responsive to their needs. The third page and last page of our strategic plan shows, if you could go to the next slide, please. There we go. 18 board-specific metrics. I'm not going to go into all of those, but just to say that we're making good progress. And we utilize this as a tracking device on a regular basis with board members so that they can see progress around reporting, around the use of metrics and data to drive decision-making, and many others, as you can see here. So one of the things, if we could go to the next slide, that the WTDB leans into is reporting. Ben mentioned this a little bit in his remarks. And we do that not only, through the strategic plan, which guides much of that reporting, but we also do it through our committees and task forces. Currently, we have about 4 committees in play, which includes the executive committee. But I just wanted to underscore a few of the important committees in which our work is done. The Continuous Improvement Committee, affectionately known as the KIC, is statutorily mandated, and every biennium on the even year, we have to work together with a contractor to conduct an assessment of the public workforce system, or WorkSource Oregon. This assessment then is forwarded to the governor's office, legislature, agency leadership, and local workforce boards, as well as many other partners. It's really resulted, the assessment, in improved connectivity and relationships with the governor's office, improved action towards more efficient and effective operations in the public workforce system, around, again, customer delivery and customer satisfaction. We are in sort of recent update about ready to release the RFP for the 2026 Continuous Improvement Committee assessment. Another committee that has been instrumental in driving work forward is the Workforce Readiness Committee. It has 3 focus areas, which include Oregon employability skills, STEM and AI tools, and CTE. It's really resulted in significant scale of employability skills development and proficiency for students across K-12 and several community colleges. Not to mention, more recently, we have significant engagement through the local workforce boards, and Oregon State University is partnering with us right now in an attempt to figure out how to integrate Oregon employability skills, which, by the way, speaking of access, there is no cost for access to this platform and earning micro-credentials for learners. Other benefits that have been realized have been pretty significant increase here as well in terms of relationships, partnerships, to really drive that systems alignment that both Ben and I have talked about. I also wanted to talk a little bit about the governor's expectation across the state enterprise around delivering that excellent customer service as it relates to WorkSource Oregon and a little bit more broadly as well. She sent a letter to the WTD back in May of last year asking the WTDB to really lean into this goal through data and outcome-driven approaches and assessing how programs affect Oregonians, setting and tracking metrics, and creating plans to meet our goals. So the WTDB, as some of you know, has the authority to hold state and workforce agencies, as well as local boards, accountable for reaching performance goals and system outcomes. Governor Kotek directed the WTDB to stand up a reporting system and associated metrics. Julia Pontoni at the Office of Workforce Investments has completed that work, and we plan to integrate that, likely integrate it into the Continuous Improvement Committee. If you could go to the next slide. Oops, back. There we go. We had originally planned to have a metrics task force handle this, but for the sake of efficiency and effectiveness, it looks like we'll probably move that work into the Continuous Improvement Committee, which will also have a charge of developing a few more additional metrics to drive results across the broader workforce system. The WTDB, as you can see in bullet number 2, is well known for hosting the HEC Oregon Talent Summit every 2 years. It also includes the launch of the biennial Oregon Talent Assessment. For 2026, that summit will be here in Salem at the Convention Center on May 19th, so please mark your calendars. It's been a dynamic event for many years now and really shapes and advances workforce and education strategy, policy, investments, and outcomes across the state. It provides a great opportunity also to explore emerging trends, shared challenges, and define actionable strategies to strengthen Oregon's workforce system and talent ecosystem. The Oregon Talent Assessment assesses current market for skills using quantitative and qualitative data, highlighting business and industry's input on in-demand occupation, skills, talent gaps, and trends. These WTDB committees and task forces typically produce other reports and assessments that are also sent to the governor's office, legislative leadership at the state, and sometimes to the federal level as well, including, as I mentioned earlier, the executive branch and really broadly to the public. So together, the Talent Summit, the Talent Assessment, and other reporting projects provide critical bodies of work that do continue to influence, shape, and transform the workforce and talent development system in Oregon. If you could move to the next slide, I just wanted to give you all a quick look-see at the current Oregon Talent Assessment and what is called out. We are just sort of starting into the work for the 2026 Talent Assessment. So although these are 2 years in arrears, I think they're really important and still relevant to call out. There's 3 strategies with corresponding buckets below those. This first one you can see is around aligning and strengthening the ecosystem. I'm not going to read them all, but you can see some of these boxes below I've already sort of touched on, like K-20 collaboration and data and reporting, for example. Next slide is strategy 2 around promoting efforts that increase workforce development and access, including equity for all Oregonians, with corresponding themes and areas of priority 6 through 12 that are included there. And then on to strategy 3, you can see that it calls out supporting Oregon's target industries and occupations through attraction, retention, and lifelong learning initiatives in items 13 through 18. I'll be happy to send out any of these documents that I've touched on later if you'd like that. Just let me know, Daria. I'm happy to do that. If you could move to the next slide. I just wanted to quickly mention that we have had a recent change in leadership. K.S. Venkataraman, or Venkat, as he's affectionately known previously with NVIDIA, is now our new chair. He moved from the vice chair into that role. Skip Newberry is our new vice chair. We're really excited about this shift, and I wanted to share some recommendations on actions that have come from Venkat very early in his new role. And those are outlined here around the unified workforce system. I'm not going to read each of those, but I do think that first one is critical as it applies to you. He really wants to formalize the interplay and process and how we work with the Healthcare Consortia and the other two consortia. Alignment is a key concern for his as well, and he wants to, as best as possible, align with the governor's prosperity roadmap. Next slide, please. Here are some other recommendations for action that he has shared with me and other leaders on the executive committee that he really wants to lean into. So these are being discussed currently. Next slide. He's also sort of pushed this forward to, I would say, inspire and reignite engagement on the part of the board and its partners around having a higher bar for members who can convene peers. I think the second one is a really important one, and one that Venkat and I are leaning into and taking a lot of action around, which is trying to get public-private partnerships going and commitments on private investment, higher impact in order to help shape statewide strategy and communicate both ways with the governor's office and the policy advisors that are relevant to the work. Higher engagement from sectors like the top three: healthcare, manufacturing, and technology, which are called out under Future Ready. And then importantly, higher accountability. Venkat wants to bring a 6-month review to the State Workforce Board and system to improve accountability. So I think that's all I really had to touch on. Some of these last remarks I've just given are hot off the press and not set in stone yet. However, I think many of them are already gaining traction with members. And I guess I'll close by saying we're excited about 2026, working with the consortium and together getting good work done for workforce and talent development in Oregon. Thank you.
Thank you, Todd. I know that we have questions for Todd. We have, due to the time constraints, we will have to move to the next presenter, but seeing how lively the chat is with questions and responses, I encourage everybody to leave your questions for Todd there. Todd, you're staying for a little bit, so perhaps we'll get answers that way. Thank you, Todd. And we are grateful to be joined by Dr. Amy Cox, Director of Office of Research and Data, who will walk us through key findings and implications for our sector. Dr. Cox, I'll turn it over to you.
Thank you so much, Daria. I don't know why my camera's not on. It says your video is still loading. So at some point soon, you'll see me, I'm sure. Regardless, I'm delighted to be with you all today. Thank you so much for having me. This is the third time I've presented a summary of the annual report to the Healthcare Industry Consortium, and it is great to be here. I want to, whoever's driving the slides, thank you so much. No, if you could actually just leave it there for 1 second. I just want to say that I am, as it says on the slide, the Director of the Office of Research and Data. And that's important for this presentation for 2 reasons. One is because I'm representing a whole group of people. This is a very large report, and it is made possible only by the work of many folks in the office. So I'm definitely part of that work, but I, in other ways, am a figurehead. So I just want to appreciate all of the folks on our team publicly. The other reason that I'm stopping on this slide is to illustrate for you all, this report is required by statute, as you probably know. It is also put together by HEC staff in our office. Our office operates separately from the Future Ready Oregon team. And that's important because what I want you to hear today is that this is, although we're all in the same agency, really an outside evaluation of the work. And that's important because sometimes, I mean, the results are generally positive, and when they are, sometimes people wonder, are you just a mouthpiece? That's not the case here. It's not the case. So we work certainly in close coordination with the Future Ready Oregon team, with grantees. They help inform the work, but they're not evaluating themselves. So I just wanted to reassure everybody of that. Next slide, please. And try turning my video off and on and see if that makes it load, but I don't know what's going on. Regardless, this slide really illustrates what Future Ready Oregon is. I'm sure you all know by that point. And by this point in the program, but I've left this slide in here really to call out the two goals of the program. Future Ready Oregon has both simultaneously this sort of intent, if you will, of addressing labor shortages, especially in the key industries of healthcare, manufacturing, and technology, as well as increasing access for Oregonians to well-paying jobs, especially in those sectors, in ways that are equitable and that address historic and contemporary barriers to education and employment. So we use this sort of dual focus throughout the evaluation and have for the last several years to be a lens through which we're looking at the progress in the program. Next slide. I'm gonna give you sort of the high level findings. This is all very high level, but the high level findings up front, and then we'll get into some more detail. This fourth annual evaluation in general, as I said, shows positive results. In terms of those twin goals, we ask across all these different programs and these different data sources and questions that we have asked throughout the year, has Future Ready Oregon led to more economic prosperity? And the program's still ongoing. This is not a final set of results, looking completely backward, but at this point, well into the program, we are seeing, yes, there are positive outcomes for participants, and there is some evidence of positive outcomes for industry. Those positive results are tempered by the fact that we cannot track employment outcomes for all of our participants. There is a significant underreporting of Social Security numbers, something that I'll explain in a little bit. Has Future Ready Oregon led to greater equity, that economic prosperity for individuals and within the industries and within the training? And yes, we see that that is happening. All priority populations laid out in the statute are represented in among the participants. I would say that almost all of them are very well represented, the one exception being Oregonians who are ages 40 and up. And lastly, a question we added this year, now that we have a few years under our belt and more data to look at, has Future Ready Oregon been effective? Sort of the ultimate question of any evaluation. And what we are increasingly seeing is yes, innovations in the way the workforce training has been designed and rolled out have made that training in general quite effective. In terms of participant outcomes and in terms of participant engagement. And it has helped more and more folks and industries reach the workforce training system, especially for participants who we were not seeing in the labor market for the last chunk of time or in previous workforce training initiatives. However, those good outcomes are limited in scale. So let's get into some of these details more. Next slide. This year's report looks at primarily at participants, of course, what participants are served, what kinds of services they received, and crucially, what their employment outcomes are. We look at that both within each of the programs in Future Ready Oregon and across priority populations, which are listed there on the right. The report also, as required in the statute, lays out the economic landscape of Oregon in which this training is occurring and what the current labor shortages and needs are and how that compares to the Future Ready Oregon participants. Discusses progress that the individual programs have made, including the industry consortia and the progress you all have made in the last year toward your goals, and then concludes with recommendations. Next slide. In terms of that economic landscape, in many ways, this slide may not be a surprise to those of you in this consortia, but it is important for us to continue to lay out for the legislature and governor that Oregon's economy continues to need workers in these key industries. Though that was not a one-time shortage that the state is facing, these shortages are ongoing. And we lay out here some indicators of that: the number of open positions, the number of difficult to fill positions, the percentage of those that require some kind of post-secondary education and training, the percentage of those that call for that ideally gather workers with post-secondary education and training is much higher than the requirements. But even with the low bar of requirements, you see the need there for the training. The average wages, the projections that this need is not going to go away, and the highest need growth or highest need occupations in the projections. Next slide. This slide summarizes the findings for participants overall for Future Ready Oregon. It looks across all of the participants, across all of the programs. We'll get into some program specific in a minute. But here what you see is that through June 30th of last year, so 4 years through the program, 27,000 participants have been served, which is a pretty large number. 27,000 over that time, 90% of whom are coming from a priority population above and beyond low income. Virtually all participants are coming from low income backgrounds, which is one of the priority populations, and 90% of them also come from an additional priority population. So this is the first critical barrier to seeing, or indicator to seeing if the program is bringing in participants, Oregonians, in an equitable way. Those participants, for where we have data, are more diverse than labor force participants overall. So in other words, Future Ready Oregon is reaching Oregonians who are more diverse than existing employed folks, than the existing labor force. And again, that's the first indicator that it is addressing these historic and contemporary barriers to education and training. Participants in general completed about 3 or received about 3 services per participant. So that ranges, of course, but in general, across the programs, we see participants getting an average of 3 services. Those services range widely from a short-term day-long workshop in resume writing or an expungement clinic for formerly incarcerated folks, to something that is longer term and focused on a particular occupation or employment pathway. We see, and this is an additional indicator of this, the good news, the positive results that we've seen, is that the completion rates of those services are very high. Some of that is undoubtedly due to the fact that some of the services are quite short, right? It's easier to have a completion rate for a short program. But we're seeing that across types of services, across programs, critically, across priority populations, these high completion rates. And then we'll get into a little bit of the employment outcomes. Among the participants who were not employed to begin with, so before they started services, they were coming into Future Ready Oregon services and they were not employed. 74% were employed after services. That's we will continue to track that. We expect that as gives participants more time, that number might rise. But in and of itself, a 74% employment rate after participation is strong. It is strong compared to other workforce training. So I want to put that into a little bit of perspective there. For participants who were employed when they started, so the employment rate is for those who weren't employed. For those who were employed when they started, we see wage gains. These are the median wage gains for participants who were not employed beforehand and then became employed after services. And we see that wage gain is sizable. So $1,670 on average across a quarter, that's about $500 a month. Hourly wages increasing also. For healthcare and manufacturing, I want to focus on this. So we tracked the industry that participants were in, not only among those who moved into healthcare, but also those who moved from healthcare to another industry, right? So we looked at the participants who became employed in healthcare after not being employed anywhere, and the participants who stayed employed in healthcare, and at the participants who started in healthcare and moved into another industry. And here we saw across all of those groups, there was a net gain for healthcare, for the healthcare industry, for healthcare jobs of about 1,300 workers. This is not enormous, but it is notable. So and it's the highest compared to, as you see, manufacturing. We can't track technology in the same way, which I could get into if there's a question. So what we want to do as a state is build on that and make it bigger. So everything's trending in the right direction there. It has not been tons of time and years. We will continue to track that measure, but what we want is that 1,300 to get even bigger to help address those industry shortages. I do want to point out that the low reporting of Social Security numbers is a limitation to all of these results. And now I'm going to go into that in a little more detail in the next slide. This shows results. This shows a couple high-level results for each of the 8 programs. There's a chapter that goes into much more detail in the report for each of these programs. So if there's a particular program you're interested in, I commend that to you, and I'm happy to take questions on that. But I want to point out here, first of all, across all of these programs, we are seeing positive results. Wage gains, employment rates, high percentages of folks who from priority populations, high completion rates. We are seeing that across all of the 8 programs. They don't all serve participants, but we are seeing all of those positive outcomes among the programs who do serve that have served participants. Our ability to track the employment outcomes, however, depends on the participants themselves reporting their Social Security number. And that depends on both the participants' willingness and the program's ability to glean that information. Grantees all have to ask, but the reporting rates range widely. Prosperity 10,000 up in the upper left has the highest rate of Social Security number reporting. It also has very strong outcomes across all of the measures, some of which are noted here. So I really want to call that out. Prosperity 10,000, as you know, implemented by the local workforce development boards. They have ongoing processes where they collect Social Security numbers for other workforce training initiatives. And you see the impact of those processes here, because we have high Social Security number rates being reported, and we can track the participants in a really generalizable way. Some of the other programs where you see the asterisk, workforce ready grants, registered apprenticeships, and youth programs, the outcomes here are less generalizable or not generalizable at all, depending on the proportion of participants who reported a Social Security number. It just makes the work challenging. It's challenging for the grantees. It's challenging for the participants. I'm not at all trying to imply anything different. You know, here you have somebody asking someone from a vulnerable population, give us your Social Security number. That is a big ask. And yet without it, we can't really see where people are going. So we continue as an office to work with the grantees to get that information, to use trauma-informed materials to be able to do so. But it is a challenge, and it's ongoing work. I do want to lastly call out on this page. I said this in a way at the beginning, but there are many more details about all of these programs in the report. We've highlighted some of the key findings for each of them. Some of these programs are now complete. Workforce Ready Grants is still underway. Prosperity 10,000 is still underway. We will continue to track the participants for all the programs, whether or not they're continuing to serve participants. We'll continue to look at their employment outcomes as time goes on, and that will be something you'll hear about more, probably about next year at this time. Next slide, please. So going back to what I said at the beginning, has Future Ready Oregon led to more economic prosperity? Yes, participants have experienced high job placement, rising wages, industries are gaining new workers. But of course, that underreporting of Social Security numbers, especially in some of the programs, really limits our understanding. Has Future Ready Oregon led to greater equity? Yes. All priority populations have been served. Completion rates and employment outcomes and wage gains are high and consistent generally across the groups. One limitation that's important to note is that Oregonians ages 40 and up are underrepresented. That is important for that group of Oregonians who might be facing employment barriers. It is also important for labor shortages, because the group of Oregonians ages 40 and up is large. We need to reach them to be able to fill labor shortages, because Oregonians at younger ages are smaller in number and are not going to be able to compensate. Right? So this ages 40 and up issue is important both for the individuals and for the state to be able to address labor shortages. And then lastly, has it been effective? Yes, we are seeing that. In particular, we're seeing that the development of new partnerships and the availability of support services have really enabled the training to be more tailored. And that is repeatedly one of the things that grantees and grant administrators point to as a key mechanism for those high completion rates and high employment rates. The programs have reached participants who were not previously reached by the Workforce Innovation and Opportunity Act. So we looked deeply for years back to see how, if we could find Future Ready Oregon participants having previously been engaged in the other large publicly funded workforce training program. And of course, we did see some of them, but there's a high percentage who we didn't see among historic participants. So that's a very important indicator that the program is reaching Oregonians who are new to workforce training, which is really great. Lastly, of course, this piece about scale. We want to expand the scale of impacts, especially around labor shortages. Last slide, or last two slides, I guess. We conclude the report with 4 overall findings and 4 recommendations that are related. These are not going to be terribly surprising, hopefully, by this point in the presentation. As I said, the availability of wraparound support services for participants and the new partnerships that training providers have made both with community-based organizations and with businesses have enabled that training to be more effective. And so we make the recommendation to continue community-centered and person-centered approaches in workforce training, both for the last year of Future Ready Oregon and for future investments in workforce training. Second of all, we see this underrepresentation of Oregonians ages 40 and older among participants. The share of older Oregonians is growing, and the share of younger Oregonians is not large enough to replace them. So we need to reach those folks in order to fill labor shortages. So we recommend intensifying the outreach and engagement of older Oregonians. And then next slide. Third, this issue of Social Security numbers. I won't keep beating that horse, but the recommendation here is certainly to increase that reporting. We have seen it increase. This was a recommendation last year as well, and we did see an increase and grantees working hard to get this. So we're hopeful that will continue in the final year. And then lastly, our last recommendation, something we have not made in prior evaluations because we haven't really been at a place in the program to have sufficient evidence to make this kind of recommendation. But this year, certainly we are making a recommendation to extend this kind of workforce development and investment that has been successful to help fill the state's labor shortages and continue to engage all Oregonians in workforce training and employment. So with that, I do see there are some questions in the chat. And let's see. Go up here. Could you determine how much of the wage increases were a result of the Future Ready Oregon investments versus typical cost of living wage increases? We certainly could compare it to a cost of living increase. The wage increase, I can tell you, is higher than a cost of living increase. We saw wage increases that were, I'm just gonna try and one more time to get my video to go up. I don't know what's going on, folks, but at any rate, it is larger. The wage increases that we saw are larger as a percentage than a cost of living wage increase. And I'd be happy to follow up with you about what that number actually is. I don't have it off the top of my head. Do we know if this report and the results of Future Ready Oregon will be used as evidence to inform the Governor's Prosperity Council? I do not know the answer to that question. I do anticipate that we will be presenting this to the Racial Justice Council's workforce committee. In terms of the Governor's Prosperity Council, that is not a request we've received. But so I'm not sure about the answer to that. We would have to engage with them. I can certainly do so, and we could also get back to you on that. With burnout and moral injury being high in the healthcare sector, particularly post-pandemic, will Future Ready Oregon be tracking workforce retention? Yes, that is a great question. Thank you. We will be tracking workforce retention. So many participants are new still in their jobs post services in the time frame that we have covered, that we haven't included that a retention measure in this year's report. But every year we include more outcomes and more measures. This year's report also looks at the percentage of participants working full-time that I didn't have a chance to get into in the presentation. So every year we add more measures, and this coming year, at the end of 2026, we will be adding a retention measure, yes. And then let's see. We need to figure out how to apply the learning from these investments into the larger system. I am in agreement, Duncan. To get to scale, we need to convene agency, philanthropy, and other community leaders to redesign systems and align funding. Thank you, Duncan, for that comment. That right there, so much of what is in your comment here is the work of the industry consortia. So one of the things we note in the report is that you all are the ambassadors of this work back into your communities of business, training, education, labor, community. So just to amplify Duncan's question, are there hypotheses on how the structure, partnerships, employer participation, worker recruitment were impactful? I think the key piece to say there, Heather, is these the new partnerships that trainees built with both communities, community organizations, and with businesses. We heard repeatedly and included examples in the report repeatedly of how what those partnerships did was it enabled the training to be more tailored and effective. So in terms of participants, and similarly the wraparound support ability, even without providing wraparound support, offering wraparound support repeatedly and partnering with community organizations enabled training providers to build relationships that were more authentic and more meaningful and more engaged on both sides, both of participants and of the training providers. And that engaged those participants in the training, and then we see the high completion rates and we see the high employment rates. And so building those relationships one-on-one happened because of the community organization partnership, which you're already standing on that relationship, right? And the wraparound support. And then similarly, the relationships with the businesses affected that training too. So with the businesses, now the training is not sort of generic or let's get you through math. The training is, well, let's get you what you need to get onto this, into this pipeline, into this company, into this occupation field. It's much more applied and focused. So that's how I would answer that. And then a comment for Duncan in the chat. And I think that's it.
Thank you, Amy. Thank you, Dr. Cox, for sharing this information with us. And thank you for replying live. I know, and I want to thank everyone for using the chat and keeping questions going and responding also and connecting with each other. That definitely will help us stay on track and on time, and to give everybody a well-deserved break. So with that, I know we're a little bit over our agenda, so please let's reconvene back at 11:25. Well, welcome back, everyone, and thank you for being prompt. Before we transition into today's forward-looking discussion, I'd like to briefly highlight several themes that emerged from our Q4 consortium conversations. And first, many of you emphasized the importance of better aligning consortium priorities with the Behavioral Health Talent Council in order to strengthen coordination and reduce the application of efforts. Second, there was also a strong interest in building a more shared understanding of current healthcare workforce initiatives, including how different programs and partners are working across the systems. We have also talked about participants noting that the value of advancing policy and funding recommendations that are aligned with both HEC and the Workforce and Talent Development Board's strategic direction. And finally, there was interest in more intentionally analyzing lessons that were learned from the Future Ready Oregon and Workforce Ready grant investments, and using both qualitative and quantitative perspectives. And we are sharing these themes to provide continuity from our last meeting and to help us ground into today's discussion that's about to start. So we'll now move into small group discussion portion of this meeting and focused on helping inform Healthcare Industry Consortium's 2026-2028 strategic work plan. In a moment, you'll be placed into breakout rooms. Each room will receive discussion prompts to guide your conversation around priorities, gaps, and opportunities in healthcare workforce and development. Your feedback will be used to help us shape future planning and identify areas for deeper collaboration. Please plan to return to the main session at 12, as will be noted on the screen. And thank you, and looking in advance for your thoughtful participation. All right, well, we'll now move into a brief report out from each group. Welcome back, everyone, and thank you for the conversations in each of the breakout rooms. I had a chance to pop in and out and listen a little bit. To help us stay on time, I ask that each group focus on high-level takeaways, key themes, or common priorities that emerged. And I'll invite each group to share in turn. Let's start with group number 3.
I don't remember our number, Daria.
Oh, we don't.
We're number 3. I'm sorry.
Yeah.
Who would like to
Rusty. Go ahead, Rusty.
Group 3, so Rusty Grease from Rope Community College reporting out. So one of the big conversations we had related to really building and strengthening the case for higher education throughout Oregon by working with partners, whether it be in industry or also talking about our adult learners and the return on the investment to higher education and how we can strengthen those conversations here as a group. We also talked about, as a consortium, like getting together as a state, as a group, and realizing that we all have similar struggles no matter where we're at, and how can we work smarter, not harder, and that realizing that areas in different parts of Oregon have likely found some really strong resolution to challenges that others may be facing. And so how can we work together to kind of share that information, whether it be through a summit that includes both industry and higher education, and all of those involved versus separating like we kind of do in our silo effect at times. We talked about strengthening opportunity for credit for prior learning and experiential learning in various different areas of healthcare, and how that a lot of students do have career ladders and they move from one area to another. And our parents' effect of being in an industry for 40, 50 years is definitely an item of the past. And so being able to not just embrace that, but to be able to push that work forward. We also talked about, focusing on a few items. We are generalist as a group a lot of the times, but can we find a few items, and should we be focusing on a few very specific items and digging into those areas and seeing what worked, what doesn't work, and how can we really help improve those areas and then expand to others. So that was kind of the big takeaways we had.
Thank you. Let's move to the next group that has no number, but who would like to start?
I can go ahead. I think some key priorities that we identified were making sure that we're coordinating on the research and projections, and really thinking about how are they connected, how are we getting all the different voices that have a stake in this work, and then really saying, we kind of talked a little bit about connecting that to making sure that all of that's shared through the multiple boards who do workforce, including the Oregon Health Policy Board that does research and policy, and making sure all that's connected. We felt like one place that's a key strategic priority potentially, and that we didn't hear this morning, was just like, what is the impact on federal policies and grants on our workforce programs, and that kind of connects to one of the places we think a collaboration is really necessary, where the Rural Health Transformation Program is coming online really quickly, and that hasn't been a conversation that wasn't embedded in the 2026 goals. That feels key for our consortium to be involved in. It's a lot of money. Could have a huge impact on workforce, and there doesn't seem to be a connection there. We also talked a little bit about how a lot of this was focused on education, but actually a lot of our workforce on healthcare is brought in from out of state. And so how are we looking at the overall workforce and how that workforce is happening, not just the workforce we're educating in state? And that we still continue to struggle and would like to try to figure out how do we not just focus on one key, because when we focus on one key problem, we miss a lot of the other stuff. So, we talked a lot about behavioral health and nursing. They've been on the list, but we're not talking about the whole spectrum of healthcare very well yet. And then key collaboration opportunities or things we think should be on the list for 2026 is like, how is enrollment going to happen as we see cutbacks in healthcare? And what does the whole world of enrollment look like? Both state workers, hospital workers, all the folks who enroll people in healthcare. Really thinking about, where does a prosperity council fit in? The governor just set up a whole prosperity council. How's healthcare worked into that? Where does our consortium work on it? I already mentioned the Rural Health Transformation Program. We also talked about technology and AI and how there's not a great place where that's being discussed in terms of workforce and how people are using technology and AI. And then we think we should collaborate more with the Oregon Healthcare Policy Board and the Workforce Committee there that's doing a bunch of work, getting a lot of data. There seems to be, we're on two different tracks sometimes. And then it was brought up at the very end that there's about to be a primary care strategy committee. So there's just a lot of places. We haven't really consolidated any of those places, and then we're not sharing information. And then an opportunity for us is potentially be a data warehouse. So I just threw all of that at you, but that was our conversation.
Thank you, Melissa. And group number 3. Well, the last group. Duncan, I think you're muted.
Sorry. So we were really inspired by the morning presentations, first of all. I mean, I think it's both the examples that Amy shared, that the initiatives that are working, as well as the work we did on data and how that's influenced the behavioral health policy that the governor's working on. I think that all speaks well of our work. But the reality is, I think we're in a new era. There isn't going to be more money for this work. We've been kind of a skunks work, testing new ideas. And the theme I think we came up with is, we've either got to take this consortium bigger or go home. And by bigger, I think it really is taking the kind of policy work we've been doing in the pilots we've been doing, and really thinking about how do we re-engineer the pathways and systems. I think really speaking to what Melissa was talking about. And to do that, I think we're sort of going, what are we trying to solve? What problem are we trying to solve? And I think there are really 2 levels. First of all, we do not have the institutional framework to redesign the system. We're starting here, but to do that, we've got to get employers really engaged to describe their needs and to speak the full range of needs across the continuum of healthcare, and to think about, as Melissa mentioned, how it's going to change with AI and other changes in practice. So we really need to get a lot more employers involved, and we need to have those employers really engaged with the schools, as well as the community-based organizations who are helping build these pathways. And so I think we've done a lot of great work, but we got to think about how to take this to a bigger level as we go forward. And then we will have to figure out what specific issues to take on. We can't do everything all at once, but we've got to start in a very structured way to take on priorities and try to build and fix the systems. As we do this, we really stressed we should be celebrating the successes we've had, learn from them, and we really need to bring in the agency partners who affect these systems. That would be DHS, the Health Authority, the Higher Ed Coordinating Commission, K-12, a lot of the different players, along with others, to really learn what we've learned and share it and think through what the implications of of our learning will be on their practices. For example, we've learned that flexible dollars for the participants really make a difference. Well, how do we replicate that? How do we make that work? We don't know, but we've got to be thinking about it. So we need to figure out how to take our learning and bring it to the policymakers who can use it to make a difference. We did talk about rural health and the importance of that. We talked about folks over 40 and how are we that's going to be a critical part of serving the workforce needs going forward. We really need to think about those populations. But again, in summary, we're really excited about this work, but unless we can scale it up, we're not going to meet our promise. Oh, the one other thing we talked about is we should be talking with the other consortia to identify what's common, because we're trying to build a new system here that involves employers, schools, and community-based organizations in a common way. And we got to figure out how to replicate that, not just in healthcare, but in other sectors to fulfill the promise of what we're trying to build here. Did I miss anything, team?
No, thank you, Duncan, for reporting out for your group. And thank you all for sharing your perspectives and for the very thoughtful input today. I'd like to close by outlining a few next steps for the consortium. First, our next quarterly meeting will be held in person, April 23rd, 2026. We'll share location and details once they're finalized. Second, our team will continue developing the 2026-2028 strategic work plan, and we'll be surely to incorporate the themes and feedback gathered today from the group discussions and the whole meeting. Third, we will begin phase 1 of healthcare supply and demand gap analysis with the goals to prioritize 2 to 3 occupations for deeper focus. And finally, we'll continue to facilitate shared learning related to Future Ready Oregon project activities so that lessons and outcomes can inform broader workforce systems and planning. We'll follow up with the meeting notes and next steps after today's session, and something also new to keep in mind, there will be a very short survey, but very informative for us. Your feedback will be very critical in the next steps planning for the meeting and discussion. So I really encourage you to take 2 minutes of your time to take the survey. And on behalf of HAC and our workforce system partners and Office of Workforce Investments, I really want to thank you all for the time and commitment to be here today, to take that valuable time out of your schedules, and then still to continue on with your day, with your busy schedules, to help strengthening Oregon's healthcare workforce system. And this concludes today's agenda and today's meeting. We really appreciate you and look forward to continuing to work together. And the meeting is now adjourned, and have a wonderful rest of your day.